How to survive a heart attack alone. After 67 life-saving tips every senior must know. The prospect of experiencing a heart attack when completely alone is a deeply unsettling thought, one that many people, particularly seniors, may dismiss with a hope that it won't happen or that someone will be nearby to assist. However, the stark reality is that heart attacks can strike unexpectedly, and the initial minutes are undeniably the most critical. The actions taken or not taken during this brief window can dramatically influence the outcome. Fortunately, even if you live alone or spend significant time by yourself, there are specific life-saving steps you can take to significantly improve your chances of survival if a heart attack occurs. This comprehensive guide will meticulously walk you through 7 essential actions to implement the moment you recognize the onset of a heart attack while by yourself. These strategies are designed to be straightforward, practical, and require no specialized medical knowledge or equipment, only a calm, prepared mind. We will dissect each step, starting with how to identify the earliest warning signals, what immediate actions to take, how to reduce the workload on your struggling heart, and even the subtle yet potent maneuvers that can buy you precious time until professional help arrives. It is imperative to stay engaged until the very end, as the final steps are frequently overlooked, yet potentially the most vital for your survival. Do not delay in learning what your body is trying to communicate. Let us begin this crucial journey of preparedness. The very first and arguably most paramount step in navigating a heart attack while alone is the ability to recognize its earliest warning signs. This recognition extends beyond just chest discomfort. It encompasses a broader range of physical manifestations throughout the entire body. Many people envision a dramatic, crushing chest pain akin to cinematic portrayals, but the truth is far more nuanced. Real heart attacks often commence with subtle symptoms that can be easily disregarded until it is too late. You should be alert for a deep, uncomfortable pressure, a squeezing, or a fullness sensation centrally located in your chest. It might feel as if something is pressing down on you, or as if your chest cavity is slowly being filled with a heavy substance. These sensations can also be intermittent, leading to the false assumption that they are minor and will resolve on their own. However, if such pressure persists for more than a few minutes or recurs frequently, it should not be ignored or second-guessed. Additional early indicators include shortness of breath, even in the absence of chest pain, creating a sensation as if you have just exerted yourself significantly even while at rest. Some individuals experience pain radiating to their arm, shoulder, neck, or jaw. Others may feel lightheaded, break out in a cold sweat, or experience nausea and dizziness. It is particularly important to note that in certain demographics, such as older adults or women, the symptoms might manifest less as direct chest pain and more as pressure in the back or stomach. Consider the case of Richard, a 74-year-old man who, while seated at his kitchen table, felt an unusual tightness just below his collarbone, remarkably similar to heartburn. He soon noticed he was unable to take a full breath and his hands began to perspire. Recalling that not all heart attacks begin with overt pain, he chose to act rather than dismiss his symptoms, a decision that may very well have saved his life. The human body often communicates distress through subtle whispers long before it escalates to a scream. In the context of a heart attack, these initial whispers represent your sole opportunity to intervene before irreversible damage occurs. Waiting for the stereotypical chest-clutching scenario could mean the window for effective action has already closed. Therefore, the next time you experience an unusual bodily sensation, particularly a combination of pressure, shortness of breath, or profound, unexplainable fatigue, cease your current activity. Do not attempt to tough it out or rationalize it as mere indigestion. The accurate recognition of these warning signals is your initial and most potent weapon for survival. Treat them with the utmost seriousness, regardless of how insignificant they may seem. Your life could very well depend on this vital discernment. The absolute, non-negotiable, and immediate next step once you suspect a heart attack is underway is to summon emergency medical services without any delay whatsoever. Dialing 911 is not merely about seeking help. It is the most effective action you can take to preserve your life. A heart attack is not a condition that can be overcome through sheer willpower or by simply walking it off. Every passing minute is of profound importance. The longer your heart muscle is deprived of essential oxygen, the more extensive and potentially irreversible the damage becomes. However, by initiating that 911 call, you are activating a system where trained professionals are already mobilizing, preparing their equipment and medications as they en route to your location. They possess the capability to sustain your life, even if your heart ceases to beat during transit to the hospital. Moreover, if your symptoms rapidly deteriorate, a common occurrence during a heart attack, you will likely be incapacitated and unable to assist yourself. This is precisely why attempting to drive yourself to the hospital is one of the most perilous decisions an individual can make in such a situation. The risk of losing consciousness, causing a serious accident, or critically delaying your own vital medical care is exceedingly high. The correct course of action is to remain where you are and allow the professionals to come to you. Reflect on the experience of Linda, a 78-year-old woman who felt a peculiar ache in her left shoulder, followed by a wave of nausea and a cold sweat. Her initial thought was to contact her son, but then she remembered a nurse's advice. If you are alone and suspect a heart attack, call 911 first. You can speak with your family later. She promptly made the call. By the time the ambulance arrived, her symptoms had intensified significantly, yet the emergency team was fully prepared. They were able to stabilize her on the scene. That immediate phone call was her lifeline. It is crucial to understand that you do not need to be absolutely certain that you are experiencing a heart attack to call for assistance. The emergency dispatcher will not be inconvenienced or upset if it turns out to be a false alarm. In fact, they would much rather respond to a situation where help was not ultimately needed than miss an opportunity to save a life. To ensure you can access help quickly, make sure your mobile phone is always kept in a readily accessible location, especially if you live alone. If symptoms begin to manifest and you find it difficult to speak clearly, activate your phone's emergency call feature. Many modern smartphones are equipped with shortcuts to initiate an emergency call, even when the device is locked. Familiarize yourself with this function and be prepared to utilize it. If you are finding the information presented in this video to be valuable, please leave a comment with the number 2 to signify your engagement and that you are actively absorbing the content. Furthermore, if you have not yet subscribed to our channel, it is highly recommended that you do so and activate the notification bell to ensure you do not miss any future informative videos. Your continued support is instrumental in our ability to produce high-quality content designed to inform and inspire you. Now, let us proceed to the next critical step. Following the immediate call to emergency services, the next most potent and actionable step you can undertake is remarkably simple. Chew an aspirin and do so slowly and calmly. Even if your hands are trembling, make a conscious effort to chew the aspirin tablet. Provided you have access to a standard 325 milligram aspirin tablet and you are not allergic to it, nor are you currently on blood-thinning medication that would make its use contraindicated, this single action can significantly enhance your chances of surviving a heart attack. Aspirin functions by thinning the blood, thereby helping to slow or prevent the formation and growth of a blood clot that may be occluding one of your coronary arteries, which is typically the underlying cause of a heart attack. By chewing the aspirin tablet rather than swallowing it whole, you expedite its absorption into your bloodstream. Scientific studies have indicated that this can provide crucial minutes, potentially enough time to restore some degree of blood flow before professional medical assistance arrives. It is generally advisable not to take aspirin on an empty stomach unless absolutely necessary. However, in the dire circumstance of a heart attack, the immediate threat posed by a blood clot far outweighs any minor discomfort from an empty stomach. Additionally, avoid taking coated or delayed release aspirin. If these are the only forms available, it is still beneficial to chew them to ensure rapid absorption. Allow me to share the story of Joe, a 72-year-old gentleman who, one morning, experienced a tightness that began in his chest and radiated to his neck. He remembered having a bottle of aspirin in his kitchen cabinet. He promptly chewed one tablet while sitting down and awaiting the arrival of paramedics. Later, his cardiologist informed him that this singular action had likely mitigated the damage to his heart muscle. The physician emphasized that this small pill had effectively prevented the situation from worsening. For individuals living alone, it is imperative to ensure that aspirin is easily accessible. Store some tablets in your nightstand, kitchen drawer, or even carry a few in your wallet. Always verify that the aspirin has not expired. Furthermore, inform your loved ones about its whereabouts in case they ever need to assist you. This seemingly minor action, though simple, is firmly rooted in scientific evidence and is a standard practice employed by emergency responders worldwide. Chewing aspirin during the onset of a heart attack is not merely a suggestion, it is a proven intervention that, in those critical initial minutes, can be the decisive factor between recovering and never reaching the hospital at all. Once you have successfully contacted emergency services and administered aspirin, your subsequent responsibility, while seemingly basic, is absolutely paramount. Cease all unnecessary physical activity. Position yourself in a seated or lying down posture that feels as safe and comfortable as possible. This is not the time for pacing, gathering personal belongings, or attempting to unlock doors unless it is an immediate and absolute necessity. Any additional physical exertion places further strain on your heart, which is already struggling to receive an adequate supply of oxygen. The ideal position is to sit upright with your back supported, your feet flat on the floor, and your arms resting loosely. This posture helps to minimize your heart's workload while you await the arrival of paramedics. If you experience dizziness or feel faint, it is advisable to lie down on your side with your head slightly elevated. Crucially, do not attempt to persevere through the discomfort with a mindset of powering through. While such a mentality may have served you well in other aspects of your life, in this critical moment, it represents an unacceptable risk. It is not uncommon for individuals to feel a sense of embarrassment about calling for emergency assistance and then seemingly doing nothing while waiting. However, it is vital to understand that doing nothing in this context is, in fact, doing something profoundly important. It provides your heart with an opportunity to stabilize, helps to slow your breathing rate, and conserves your body's already limited oxygen supply. Consider the experience of Alice, an 81-year-old woman who, upon feeling a radiating pressure across her chest, initially felt compelled to tidy her kitchen and present herself composedly. However, she recalled her doctor's advice: if you suspect it's your heart, sit down, everything else can wait. She sank into her favorite recliner and waited for help. This stillness, she later learned, likely prevented her symptoms from escalating into full cardiac arrest. Therefore, if you ever feel those telltale symptoms beginning to emerge, pressure, shortness of breath, dizziness, resist the urge to finish what you are doing. Stop precisely where you are, or move with the utmost minimal exertion to a safer location. Sit or lie perfectly still, breathe slowly and deliberately, and allow your body to focus solely on its primary objective, survival. Furthermore, here is a simple yet often overlooked point. If you are seated on a chair without armrests, avoid slumping. Maintain an upright posture with your spine supported and your chest open to facilitate unimpeded breathing. The more relaxed and upright your position, the less effort your heart is required to expend. If you are still engaged with this video and finding the insights presented to be beneficial, please leave a comment with the number 4 to indicate your active participation and that you are present. Additionally, if you have not yet subscribed to our channel, it is highly recommended that you do so and activate the notification bell to ensure you receive all future video updates. Your ongoing support is crucial for us to continue creating valuable content that aims to inform and inspire you. Now let us transition to the subsequent critical step. In the event that you still possess sufficient strength after initiating the emergency call and settling into a resting position, one of the most impactful contributions you can make is to unlock your front door. This may appear to be a minor detail, but in a life-threatening emergency, even seconds are precious, and a locked door can significantly delay critical treatment. While paramedics are trained to gain entry by force if necessary, such forced entry consumes valuable time, can cause damage to your property, and may even startle or injure you if you are located near the point of entry. Unlocking the door in advance allows them to enter unimpeded and commence care immediately. This simple act can shave off precious minutes that your heart may not have to spare. If you reside alone, particularly in an apartment or within a gated community, it is prudent to contemplate the logistical aspects of emergency access long before a crisis occurs. Is your door readily operable from the interior? Is your address clearly visible and easily identifiable? Is there a spare key accessible to a trusted neighbor or friend? These are considerations that may not seem urgent until they suddenly become paramount. Consider the experience of Paul, a 76-year-old gentleman residing in a small condominium. When his symptoms began, he not only called 911 and chewed an aspirin, but also unlocked his front door, all within a time frame of less than 2 minutes. The paramedics subsequently reported that this single proactive measure allowed them to reach him approximately 30 seconds faster and eliminated the need for them to break down the door. Paul later reflected that this was the last thing he would have considered, yet it may have been the very action that ensured he received timely medical attention. If the act of walking to the door poses too great a risk, do not attempt it. Remain seated and focus on your breathing. However, if you are in close proximity to the door and feel stable enough to reach it safely, proceed to unlock it. You might also consider the installation of a smart lock that allows for remote access or a medical lock box to secure your key, especially if you live alone or have mobility challenges. This is a small act of preparation, but it conveys a vital message to the individuals who are coming to your aid. You are ready, you have done your part, and now it is their turn to provide the essential care. During the critical period of waiting alone for emergency responders, your mobile phone transforms from a mere communication device into an indispensable lifeline. One of the most intelligent ways to leverage its capabilities at this moment is to switch to speakerphone mode. This allows you to engage in conversation with the emergency dispatcher hands-free, enabling you to dedicate your full attention to breathing and maintaining as much composure as possible without the need to grip your phone tightly or hold it to your ear. Under such duress, even the simple act of holding a device to your ear can impede your ability to breathe effectively. Utilizing speakerphone not only reduces physical strain, but also ensures that the dispatcher can hear you more clearly, particularly if you suddenly become too weak to speak. Furthermore, it allows them to listen for auditory cues in the background that might indicate your condition, such as your breathing patterns, movements, or even the tone of your voice. Beyond this practical application, every modern smartphone now offers a feature of equal importance: your emergency medical ID. On iPhones, this information is accessible even from the lock screen. Android phones typically have a similar function. This feature stores vital personal health information, including your age, allergies, current medications, and pre-existing medical conditions. If you are unconscious when paramedics arrive, this data can be invaluable, saving critical time and guiding their treatment decisions. Take the example of Susan, a 79-year-old woman who lost consciousness just moments before medical assistance arrived. However, because her phone had her medical ID feature pre-configured, the paramedics were immediately aware that she was diabetic and had a severe penicillin allergy, preventing them from administering a medication that could have exacerbated her condition. They were also able to contact her daughter using the emergency contact information directly listed in her phone. Setting up this vital information typically takes less than 5 minutes and remains a permanent record. It is important to include your full name, date of birth, any significant medical conditions, medications you regularly take, known allergies, and 1 or 2 emergency contact individuals. This feature is not exclusive to individuals who are technologically savvy. It is an essential tool for anyone who might one day require emergency assistance when they are unable to communicate their needs themselves. Therefore, if you begin to experience the initial symptoms of a heart attack, immediately switch to speakerphone. Maintain your connection and place your trust in the person on the other end of the line. Their calm voice, steady guidance, and consistent presence can significantly alleviate the anxiety of waiting. And should your condition worsen before help arrives, your phone may continue to speak for you when you can no longer do so yourself. If you are still watching this video and find the information presented to be useful, please leave a comment with the number 6 to indicate your continued engagement and that you are present. Furthermore, if you have not yet subscribed to our channel, it is strongly recommended that you do so and activate the notification bell to ensure you do not miss any future video releases. Your consistent support is instrumental in our ongoing ability to produce high-quality content designed to inform and inspire you. Now, let us advance to the final yet profoundly significant step. In the midst of a heart attack, it is remarkably easy to succumb to feelings of panic. Your chest may feel constricted, your thoughts may race uncontrollably, and each passing second can feel amplified and more urgent than the last. However, you still possess one potent tool at your disposal: your breath. If utilized effectively, your breathing can help calm your nervous system sufficiently to provide your struggling heart with a better opportunity to maintain a steady rhythm. Controlled breathing is not a cure for a heart attack. Rather, it is a technique to prevent your body from spiraling into full-blown shock while awaiting medical intervention. The more anxious you become, the faster your heart rate may increase. However, by deliberately slowing your breathing, you can gently guide that rhythm back down. You do not require a complex or specialized breathing technique for this. Simply try the following. Inhale slowly and deeply through your nose for approximately 4 seconds. Briefly, hold your breath for a moment. Then, exhale gently and completely through your mouth for approximately 6 seconds. Repeat this cycle. Focus your attention on this singular, deliberate rhythm. It provides your body with a stable point of reference, an anchor, and can help prevent your heart from entering dangerous arrhythmias that are often triggered by stress. Consider the situation of Frank, an 83-year-old gentleman who, when the pain struck, felt an overwhelming sensation of drowning in fear. However, he recalled a simple breathing exercise his doctor had taught him during a routine checkup. He meticulously focused on each breath, maintained his physical stillness, and consciously released the panic. By the time the paramedics arrived, his heart rhythm was still unstable, but it had not progressed to full cardiac arrest. He later recounted, "I just kept thinking, stay calm, stay alive." You can practice this breathing exercise at any time, while resting, when feeling anxious, or even while watching television. The more familiar the rhythm becomes, the more instinctively your body will revert to it when faced with high-stakes situations. Your breath will not mend your arteries, but it can buy you crucial time. It can ensure that oxygen continues to circulate and help your heart to hold on. And in those final moments before help arrives, that sustained effort might be the only advantage you need. Remain still, remain alive. At the conclusion of this discussion, it is essential to underscore that successfully surviving a heart attack while alone is not solely a matter of chance. It is the direct result of thorough preparation, keen awareness, and the implementation of calm, decisive actions. These 7 steps, while seemingly modest individually, coalesce to form a formidable chain of defense capable of saving your life. The ability to recognize the warning signs, the commitment to call for help immediately, the readiness to take aspirin if feasible, the wisdom of sitting or lying down to conserve energy, the proactive measure of facilitating access for emergency responders, the judicious use of your phone's features, and the calming effect of slowing your breath to stabilize your heart. Each of these actions contributes to buying you precious time and affording you a greater degree of control. More importantly, each step conveys a powerful message. Even when you find yourself alone, you are not powerless. Heart attacks can evoke the most profound sense of solitude, but these implemented strategies serve as a potent reminder that you are not truly helpless, not even for a fleeting moment. You possess tools, you have acquired knowledge, and now you have a well-defined plan. Therefore, consider which of these points resonated most strongly with you today. Was there a particular step you had not previously considered, or one that you now view in a different, more significant light? Take time to contemplate how you can integrate this knowledge into your own life and, crucially, consider sharing it with loved ones you care about. This information may not only save your life, but could also be the key to saving theirs. Thank you for joining us for this vital discussion. We genuinely value your input. Please share your thoughts in the comments section below, highlighting one specific takeaway from today's presentation and how you intend to apply it in your daily life. Your perspectives are incredibly important to us, so please do not hesitate to share them. Reading your comments provides us with immense motivation and encouragement to continue our work. If you found this video to be informative and helpful, please express your appreciation by liking, subscribing, and sharing it with your network. Your support is instrumental in enabling us to continue creating valuable content that aims to inform and inspire you. Thank you for watching, and we eagerly anticipate your presence in our next video.